2, and 1.
Okay, we are live. Thank you, everyone, for joining today's webinar. My name is Nadia Sereni. I am the Director of the Primary Healthcare Branch here at the Ministry of Health. I want to begin with a land acknowledgement that recognizes our homes and workplaces are on the traditional territory of many nations. These are comprised of the Mississaugas of the Credit, the Anishinaabeg, the Chippewa, the Haudenosaunee, the Huron-Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We honor their connection to these regions and give thanks for the opportunity to live, work, and learn on the traditional homeland. Today, we are committed to working with Indigenous peoples and residents to pursue a united path of reconciliation. It is my absolute pleasure today to invite and welcome Elder Marie Gaudette to join us in opening our webinar today. Marie is a member of the Wikwemagong First Nation located on Manitoulin Island. She was born and raised in Toronto. She is the mother of 7, 5 boys and 2 girls, and a grandmother of 2. She presently works as a native language instructor and traditional knowledge keeper. She works closely with the elders, council, and administration in designing and delivering cultural appropriate programming, such as Clan Day teachings, seasonal drum fest ceremonies, and land-based learning activities. Marie is a member of the G-Wedanang Council at Aboriginal Legal Services in Toronto. She provides teachings, singing, ceremonies, and support to community. She also assists in support work in other agencies such as Native Child and Family Services and the Native Canadian Centre of Toronto. Marie is a storyteller, singer, traditional song composer. You may hear some of her songs on Women's Voices for Attawapiskat and Miji Red Sky Performance, Power in the Blood, backup singing for Buffy St. Marie. Thank you very much, Marie, for joining us today and helping us open our webinar today. I'm going to pass it right over to you. Thank you.
Good afternoon, everybody. Minadora Makwena Dishnikaz Turtle Clan. And I lit some medicine here as I am doing this opening. And this medicine, the way that it works for me is to, think good thoughts, use the medicine to see good things, to hear good things, and to speak good words to my heart so I feel good, onto my hands so that I do good work with my hands, and down to my feet so that I walk in a good way. And I'm going to start off with a song, open us up with a song, and I will do a Thanksgiving after this. often like to start my sessions off with a song, because that is our original form of communication. When we come into this world after hearing the heartbeat of ourselves and our mother, that is representation of that drum, we come into this world and we express ourselves. And some people call that crying, but our elders call it our first song in creation. And so with that, I would like, I'll start with my Thanksgiving. Chimigwech, Gishem Nado, Kinegego, Gishatoyen, Kinegego, Gamijiong, Chimigwech, Gamijiong, Ake, Chimigwech, Gamijiong, Nabe, Chimigwech, Gamijiong, Niwan Nakaying, Wabanong, Shaonong, Ningabianong, Giwednong, Chimigwech, Gamijiong, Bimatsawin, Chimigwech, Gamijiong, Wesayag, Nibi Wesayag, Chimigwech, Gimijiong, Mishgi, Manwang, Netagiong, Chimigwech, Gimijiong, Mitigok, Chimigwech, Gimijiong, Beneshiik, Chimigwech, Gimijiong, Gizes, Minwatabik Gizes, Chimigwech, Gimijiong, Nungosak, Chimigwech, Gimijiong, Bogonegijik, and the hole in the sky from which we came. And I gave thanks to everything that came before us as humans. Before we walk this earth, there was a system already in place, and we were given an opportunity to be here. So always we want to acknowledge the land, the water, the four directions, and the water animals and the animals that roam on the earth, and the birds and the trees and the medicines and all the foods that grow here, our grandfather sun and our grandmother moon, and all the stars in the night sky, and all the star stories, and that hole in the sky from which we came. And we take this moment to reflect on all of that as we have come here, gathered here today to do work that is in the best interest of our future generations, those ones that have yet to come. And we ask for that work, that work that we're doing to be effective for 7 generations forward. So I just want to say Chimigwech for inviting me here today. I hope you have an awesome session this evening, and yeah, Miigwech.
Miigwech, thank you for opening up our webinar today. On a personal note, I just want to say every time I have the opportunity to be part of an opening by an elder, I learn more every day. And so thank you for sharing your knowledge and your time to help us be better and learn more. And I think that for me is a real personal journey. And so really thank you for taking the time today. So we will start our webinar today. As you're aware, the funding announced in Your Health, a plan for connected and convenient care, as well as the budget, includes a plan to connect more people with primary care closer to home in communities across the province. Many of you know, as you've perhaps looked at the EOI and read some of the information in the budget and in Your Health, the Ministry and Ontario Health are co-managing the process for this funding. And so I'm joined here with my colleagues from Ontario Health, as well as my team here at the Ministry of Health. The expression of interest was released on May 10th for this funding. The application form, as well as some supporting materials and details, are available on the Ontario Health website. Just wanted to quickly say a couple things. The first is this is an open call for applications. It is an opportunity to submit a request to be considered for funding. We had a webinar earlier this morning. Really excited about the interest and the questions that we have been getting from many people across the health system. We are encouraging submission of applications if there's a need in your community that you're interested in delivering programs and services to fill the gaps that we have in primary care. So I just wanted to say it's exciting to be here today. We will walk through the expression of interest and in a quite detailed way today, so that you understand the application form. I'm sure many of you had time to read it, but just going through each of the sections and giving you a little bit more detail of the things that we'll be looking for. And if you, of course, if you have any questions, we're here to answer those questions. We'll try to do as many as we can in the time that we have, but we are available. Our colleagues at Ontario Health are available as we embark on this process and as you complete your application forms. So on that note, I will probably pass it to Zara. She will, from Ontario Health, and she will give us a little bit more on housekeeping details, how to ask questions, make sure that you have everything you need during this webinar to give you the best opportunity to ask questions while we have this. And this is not the only opportunity, but we had a pretty good webinar this morning and we're able to answer a lot of questions. And so I will pass it over to Zara.
Thanks, Nadia. So Zara Small, Senior Director for Primary Care and Social Determinants at Ontario Health. Happy to be here and very excited about this expression of interest and all the applications that we'll be seeing in the coming weeks. So just a couple of housekeeping things. This is a Teams live event, which means you can't actually turn on your video or unmute your mic. You can submit questions. You can submit them through the right-hand side on the Q&A panel. They come into the back end and then we're able to sort of publish them. If you want to turn on captions, you can do that as well. And you can actually also use the DVR controls if you'd like to pause or rewind, or you want to sync with the live event. So with that, I will pass it. Oh, and the webinar will be recorded. So with that, I'll pass it over to Fernando.
Thank you, Zara. Fernando Tavares, I'm the Program Manager for Interprofessional Programs at the Primary Healthcare Branch of the Ministry. I'm going to try to take you and expediently through the expression of interest form, so we have lots of time for questions and answers. So for today, I got this thing working. We're going to try to provide you some guidance on the completion of the expression of interest form. So that's required for you to apply for the expansion or the creation of new interprofessional teams. And we're going to try to address as many of your questions as we possibly can about the form, the process, and so on. So first of all, I wanted to start with some of the basics, some of the really, ground floor kind of stuff. So the things that you want to do is consider the relevant information. So review the information and use the tools available to you at the Ontario Health website prior to completion of the application. There are tools there, and there'll be links to places where you can get assistance and so on, but do take the time to review the materials that are available to you before you finalize your submission. You do need to submit on time. The timeline is 5 p.m. on Friday, June the 16th. You can submit by email to the regional contact at Ontario Health. There is a lookup function in the Ontario Health website if you don't know who that is or what region you're in. We would like you to submit in either PDF or Word format. And in the email that you send in, we want you to use in the subject line your organizational name or proposed organizational name, and then followed by IPC EOI application submission. That will help triage and move everything into the right places so that your application does not get lost, does not get treated differently. So as long as it has that on there, it will all go to the evaluation process. So you do want to provide us with a complete submission. That means you answer all the questions, whether there's relevant information there or not, but we want those questions to be clear, complete, and concise. I'd like to focus on concise. We're not looking for novels. We're looking for, pretty, the information is fairly basic in some places, but we're looking for you to just articulate your story, give us your vision, give us your, what is that you're trying to do. And you don't have to necessarily write a book on this one. You do want to include, if you want to include supporting documentation, please do be clear in identifying your appendices to your submission. The form is the form, and then there'll be additional appendices if you want to submit some supporting documentation, studies, whatever you want to support with. If, however, you're providing us with some letters of endorsement, please have those signed, so that you know, we will not accept unsigned endorsement letters. As Nadia has already said, please seek assistance as necessary. If you have questions on how to complete the form, if you experience technical difficulties with the form, please do not wait until 5 p.m. on the 16th of June to find out that there are problems with your technical ability to submit the form to OH. However, please note that OH is not here to help you complete the form, endorse your submission, or review your application. OH will do the first part of the evaluation. So they'll do the evaluation piece. They are here to evaluate the proposals, receive the proposals, and they will do the endorsement for the ministry. They were the ones that moved the applications forward to the ministry. So in that role, they are not here to write proposals or help you in that manner. You can, however, seek independent counsel and financial advice as needed on your own. But you know, that's up to you to decide if you want to do that. But those are really the basics. And now that we've kind of gotten over some of that level of detail, I'm going to walk you through the actual form, section by section and item by item. So the form is broken up into 3 sections. The first section is really to tell us about you as an organization, who are you, where you are, who you are, and you know, there is a consent portion to the form. So let's begin with question 1.1. So 1 is the section 1.1 now becomes the first question. The question asks for you to name a principal applicant. Even if you have a multiple group of people applying together, you still have to have one principal applicant. We need to know who it is that we're going to be able to contact for questions and further follow-up and so on. So there needs to be a person that will act as the principal applicant. Doesn't mean that you can't have a group of applicants come together with a proposal. Just means that we want one person to be able to contact. Please indicate the name of your Ontario Health Team if it's applicable. So if the applicant is part of an Ontario Health Team, please name that. You'll see some other pieces about Ontario Health Team and some of the other questions as well, so we'll expand on that later. Second part of the question asks applicants to indicate whether there is a proposed IPC and interprofessional care team, and whether or not that's an expansion of an existing team or the creation of a new team. So if you're expanding an existing team, you could be adding new members, a new satellite, new service locations, those kinds of things. If you're creating a new team from scratch, then you need to identify that and to identify the model in which you intend to propose that you follow. So if you're an existing team, you already have a model. If you're creating a new team, you need to tell us what that model is. CHCs, family health teams. IPCO is Indigenous Primary Healthcare Organization. That's kind of the catch-all for the Indigenous governed groups. If the proposal is for a new type of team, you'll have to give us a description of what that type of team means. What's your intention? So Nadia has said in the past that the ministry is agnostic on the type of model that we fund through this investment. It can be an existing. If CHCs, FITs, NPLCs, IPCOs are our 4 primary interprofessional teams, but it could be something new. Before we move forward, Zara just would like to advise folks that there is a voting piece on the questions and answers so that we can bump the question that is most popular to the top of the list, so that when we moderate the Q&A session, that we tackle the question that's more prominent for everybody's, everybody's questions. We try to get through as much as we can, but that way it gives us an opportunity to be able to go, from top to bottom. We good? Good. Thank you. So question number 2 in this section is about your governance. So we want you to tell us about what your governance structure is going to look like now, will look like in the future. So things like, what type of governance structure do you have? Is it a community-based, skills-based, do you have an advisory board, those kinds of things? How big's your board? Those types of information. Patients, how do you involve patients and community partners? How are they going to be involved in making decisions and board policies? You may consider adding an organizational chart if you so choose. If you're proposing a new team, you won't have that. So if you don't have that, and you're not yet incorporated as an not-for-profit corporation or some other form of structure that's acceptable, you need to detail for us what that organizational structure is going to look like. So for your new entity, your new structure, what is that organizational structure? What does it look like? There's no right or wrong reasons in terms of whether you need to, if the question is, do you need to have one before you apply? The answer is no. If you're starting from scratch, you can just propose something. Implementation takes time and allows people to develop some of those more formal structures, but you need to kind of give us an idea of what it is that you're proposing if you're new. Question 3 is the team composition and model, and this is where people are going to put in who are the proposed team members that you're putting forward. Is it the new team? If it's a brand new team, all those new team members. If it's an expansion, then who are they that you're expanding? What are they going to do? What are their full-time equivalencies? Which types of disciplines are you applying for? And then if you, where applicable, an indication of the state of readiness of your team. So if you have people that are already committed, letters of commitment from either physician groups, physicians, NPs, other practitioners that are committing to joining the group, not required, but doesn't hurt your application. Primary care model. So in the response to this question, you should be providing information about how the team members will work together and in partnership with non-team members to deliver the programs and services. There is a community focus on some of this investment, and there are some priority areas as well that we'll talk about through the presentation. But you should be articulating to us how your team interacts with other teams, how collaboratively you deliver care to patients in the community or the area that you're planning to serve. How will care be organized so that it maximizes the scope of practice for the practitioners that you are planning on utilizing to address the needs of vulnerabilized, marginalized, and unattached patients? Those 3 words, vulnerable, marginalized, unattached, will keep coming back because they are the priority for this investment. So you will need to tell your story about how you're going to address the gaps in those specific areas. Questions 1.4 through 1.7 are about partnerships and collaboration, and I've kind of condensed those because they're all very similar in nature, and it really talks about how you're going to engage and collaborate with Ontario Health teams and other partners. What consultations have you had in the community? What engagements have you had with other partners like physicians? What are the results of those consultations? How has the local health and service partners been involved in the design of your proposal? So you can tell us a little bit about that. If you have partnership and a letter of commitment from your local OHT is not mandatory, but it is strongly encouraged. So there is a strong encouragement to be linked in with OHT planning. If you're not part of an OHT, then just tell us why. Describe how you intend to work with others to build those partnerships. It doesn't work for all, but at least you should be articulating how you're going to build partnerships amongst different organizations to deliver services with an intent to not duplicate. So we don't want to see folks duplicating services that are already in existence, but that's something that you would want to address through the answers to these questions. So that's section 1 of 3. So we're getting through this. Section 2 is about the community. So, communities in which the proposed or existing team will be located, provide services, and so on. So, it'll also ask you about the population health of the population that you're trying to serve. So the first question in section 2 is about population health status. So describe the population health profile of the community your proposed or expanded team will serve. Things like demographics, health status, prevalence of health conditions, socioeconomic status, any other information that are unique, such as, the Francophone Ontarians, newcomers, racialized, cultural groups, those kinds of things that show up. This is your ability, this is your opportunity to tell us your story about the people that you're going to serve at a very local level. Be it through, your own EMR data or other demographics and data within the community. It is actually quite difficult for large organizations like the Ministry and Ontario Health to get details about people that you're actually going to serve, because they're going to be a unique set of peoples in many cases, and data is not generally available at that level. But there's lots of local studies and local needs assessments that continue to happen that can inform this kind of situation, and you can compare with more regional and provincial data in terms of making your case. We're also going to ask you to articulate to us, what are the existing primary care services that are based within the community, and what are, how do you work with those? But what are they? Identify the primary care service and program gaps that exist. So in order to know what the gaps are, you need to understand how the system is working locally. Are the difficulties clients experience in terms of access, attachment, again, that attachment piece, unattached is a target population. You should explain why clients are experiencing difficulties in accessing care, including access to specific primary care services that you've identified as gaps. So sometimes we get asked this question about question 2.2, and that is, why doesn't the ministry already know this? In some cases, we will. But this also articulates to us that you know this, that you understand your own needs within your own community, that you have a plan to work with others to deliver on the addressing gaps within those areas. You just need to tell us about it, and you need to show us that there is a planning process that's been taken and has addressed these issues. 2.3 is around strategic alignment, and this is about the focus that we have already outlined around serving unattached, vulnerable, and marginalized populations. We keep flipping the order a little bit because they're all equally, depending on where you are, it could be one or the other, but they're all important aspects. So that's the key focus of the of this initiative. The response to this question should demonstrate how your proposal aligns with this and other strategic priorities, such as the ones in this section of the form. And so there are some things there. How will your plan, programs, and services contribute to increasing attachment? And we're getting back to the unattached for regular primary care, reduce barriers to access for vulnerable and marginalized populations, and generally improve health outcomes. Which of these priorities will you address? So don't feel like you have to put a proposal in that addresses all three. You can, that would be great, but like you don't, there isn't a requirement that says you have to address all three. Depending on your situation, you don't necessarily have to, but your response should include actions planned and accountability. So how are you going to hold people accountable for doing what it is that you are committing to doing through your application process? So that's section 2. Section 3 is about your clients and programs. So we're going to get into, who are the priority populations that you're going to serve. Provide information about the primary care needs of that population that you intend to serve. So now that you've identified who you're going to serve, you need to tell us about their needs. Describe why they're priority populations in your communities. Are they currently without a provider? Do they, their chronic diseases, mental health, addictions? Are they elderly, newcomers, refugees? Whatever's applicable, this is the place where you want to include that. Provide information about the size and types of the priority populations. So it's great to say that you have newcomers, but at some point you have to say what number they are and how many there are. What's the scale? Socioeconomic status, so that could include housing, environmental conditions, and unemployment, income, wealth distribution. So what are those things that influence the health of the population? Disease burden, modified risk factors, the age of the population. Are you in a highly a seniors area, or are you not in the, those kinds of things? Are there lots of babies? Are there lots of other things that you need to tell us? That's the priority population that you're going to serve. So you want to tell us your story based on the population that you're going to serve. So you need to identify the population. Now you're going to tell us about who they are. And then you tell us about what programs and services you're going to deliver to that population. So what are those services that you're proposing to deliver with the funding that you are seeking from the government? What are the staff members and the FTEs that will be involved in the program? So before you told us how many FTEs you have, and it's a bit counterintuitive that comes first, but you can work on it at the end after you do all this other planning, and then identify all the staff. But in your programs, if you're saying I'm running a program X to serve this population, then what are those people that are going to be delivering those services? How many FTEs? What type of practitioner will be involved at a program level? Who are those? Who is the target of those programs? How many patients are we planning on serving? Are we talking hundreds of thousands, or tens of thousands, or thousands? So we need some scope, some degree. Are they going to be accessible? Are those services going to be accessible to the broader community, or just those people registered or currently enrolled with the people that you're partnered with? Or in a FIT example, the affiliated physician group. So are you proposing to just target serving the patients that are enrolled or registered with the current group, or are you proposing to open it up to the broader population through other methods like self-referral and so on? So this response should relate to the community and population needs that are discussed in section 2 and also in the previous question. So we now have a bunch of programs, and this is the second OHT question, which is, how do you plan to explain how your expanded or new team will work with a local OHT where applicable? There's an understanding that not all proposals will have a link to an OHT. It's not a mandatory requirement, but there is an interest in understanding better how you're going to partner with an OHT. Is your proposal aligned with priorities of the local OHT and any related initiatives you can support, such as navigation, implementation of clinical pathways, advancing population health? So there are, again, alignment with priorities is, we're giving you lots of hints in this, in what we're giving you here. This stuff is pretty much all in the application. So if we've said it in the application, you should think about it, and you should include something about it, or you should say that's not part of my plan. So how are you going to partner and build those partnerships and provide that continuity of care? 3.4 asks you to articulate a little bit about your digital health solutions in your service plan. So things such as virtual care options. How will you use virtual care tools and digital health to improve patient experience and support care integration? Pretty straightforward, I think. So, take time to articulate digital. How is digital going to help you do things better and improve things? There's another section, section 4. I think I lied earlier. I said 3 sections, it's actually 4. So now that we know what we're doing, how we're doing stuff, now we got to talk about actually doing the stuff. So implementations and how do you manage risks? So the implementation plan. So here you want to give us a detail about your readiness to implement your proposal. How long is it going to take from approval? What are those key deliverables and milestones? What are those actions that you need to deliver on? What are the timelines? Who's going to do it? How soon? Do you have a human resource plan to help recruit new staff? Because human resource recruitment is a challenge everywhere. So do you have that support, that network already established to be able to actually hire the people that you're proposing? Need to articulate that to the evaluators so that they can understand that your readiness to implement is at a certain stage. Capital needs, if your proposal is dependent on some capital, either through leasehold renovations or, or building buildings, that will take away from your readiness to implement in terms of timelines. But we need to understand what the timelines look like, types of activities and budgets, and where are we going to actually deliver these things, because it could be almost anywhere. This is a provincial-wide call, open to all, so we just need to understand what part of this big province we're talking about. Risks and mitigation. Have you identified any risks factors that may affect the length of time your proposed team would need to become fully operational? We would all like you to be fully operational the day after we give you the approval, but that's not reality. Availability of health professionals in your community. If you're proposing a health professional that's not available in your community, then are you ever going to be able to hire that person? So please be conscious of that when you propose the types of people that you're looking to recruit. Delays that may be caused by capital expansions, other issues. This is a section to be able to identify those risks. And this has been in almost all of our applications, all that I remember anyways. Have you thought through what are the potential pitfalls to actually implementing the plan, and how are you going to manage those pitfalls? So that's a place for you to put that in. Quality improvement and learning, using data and evaluation, continuous quality improvement. What's your plan to collect, share, use that information? Everybody that is an interprofessional primary care team has to develop and implement a quality improvement plan. If you're already in existence as an interprofessional team and this is an expansion, you already have this in place. Just articulate what that is. If you're new, try to get an understanding. The OH has a website dedicated to health quality, Ontario. So take a look, see what's up. So how do you actually do this quality improvement piece? How do you include patients as members of your learning team, and so on? And that is the end of the questions that you will have to address in the expression of interest form and the end of my presentation. So I'm passing it on to Zara to do our Q&A for the last 20 minutes.
Thank you, Fernando. And thank you to those who have put questions into the chat. So let's start with the most popular question. If we have several organizations in our OHT that are applying for funding, do we submit separate applications as different organizations with support from our OHT, or do we do one application that describes the various programs and projects?
Really good question. I would say I'm happy that there's a lot of interest from different organizations within an Ontario health team. The preference would be to have one application with multiple partners. That would be, but I will honestly say, I understand sometimes on the ground that may be tough. So I would encourage you to be in touch with your contact at Ontario Health and the Ministry of Health as you start thinking about what this means on the ground. But I would say, in short, yes, one application that describes various programs, initiatives, as well as multiple partners is something that we would be looking for. But I don't want to pretend like I understand exactly what's happening on the ground. So always open to that dialogue and conversation as well.
Thanks. How many applications does the Ministry and OH expect to receive from this EOI?
I'm not sure how many we expect. I think the one thing that I will say, we've been getting a lot of questions about, the ministries of why there was an expression of interest, why was there an open call, and why are we encouraging everybody to apply? And the reason I would say that we are doing that is because we want to better understand the primary care gaps and the needs in local communities. And so that is why we did an open call for applications, so that as we think about this particular investment, we also think about as we plan for the future. So I would say to you, the short answer is I don't know. I really don't know how many applications we are going to get. I am based on the participants in the webinar, the number of calls we've been getting, and prior to the release of the EOI and the number of I want to say proposals we got before we even posted the EOI, and over the years has been quite large. So I'm expecting a pretty high number.
Will partially funded applications be considered? So do you want us to put a min-max in the proposal, or is it all or nothing in terms of funding?
So I know that there's been a lot of questions about this, particularly should proponents think about what is reasonable given the total amount is $30 million. And I would say we want to know everything. We want proponents to submit their entire ask so that we can engage in a dialogue that may result in partial applications being funded. Like, it may result in that, but I would say please don't limit what you share with us in terms of your request. Please give us as much information that you can, and share with us what you are thinking in terms of a total budget. Please share that with us. I think partial funded applications, yeah, they probably will be considered, given, when we see how many we have, what we're looking at, when we look at where the intention of the funding in areas of need. And so I think we'll need to really have that dialogue.
In an area where there's an OHT in development, are EOIs only allowed to be submitted with the approval of the OHT? What do we do if the local OHT is telling us we can't submit unless they give us permission?
Please contact us at Ontario Health. I will say that. I will say being part of an OHT, and I think Fernando mentioned this, or having endorsement from an OHT is not mandatory, but it is encouraged. We are all trying to work hard towards integrated care, with multiple partners. We're trying hard to better understand what is happening on the ground so we can look at perhaps, where things are duplicative in terms of service delivery, what's best for patients when we really talk about integrated care. I will say, please tell us why you're not engaged with an OHT. If there are certain challenges that you are having, we'd like to know about those things. I would say we're on a bit of a journey, I would call it, with Ontario Health teams, and there's variability across the province for sure. So it would be very helpful, and I know I did say that you don't need a letter, it's not mandatory, but please provide us with a rationale or some understanding of the challenges or unique needs that you have in your local community with respect to Ontario Health teams.
Will there be a preference or equal weighting for applications for expansion or new teams?
I think we have to see what we get. I think we are expecting a couple things. I think we are expecting a pretty broad range of expansion of existing teams. New can be defined in different ways. And new could mean expansion of an existing in a new site. It could be a net new, or it could be a completely different innovative model where we will ask for a lot of information on governance and understanding that. I think, when you have existing models and existing governance in place, then you understand how that works. But if we don't know, then we are asking people to describe that. So I think in short, what I would say is there's no preset determined amount of how much will be for existing and how many will be for net new. But I would say in the expression of interest that Fernando went through, and I think Zara also mentioned, is a real desire to understand readiness. I think there is a real need in this province for primary care. And so I just, readiness to do what we're all trying to do, which is improve access to primary care, and how fast can that happen will be important to look at.
Thanks, Nadia. When will decisions be made and when will dollars flow?
Wow. Okay. So when will decisions be made? The proposed goal is for successful applicants to be notified in the fall, and that's the best that I can provide. That is, and if you listened carefully, I will say it again. The proposed goal is to have successful applicants announced in the fall. I think it is a long application. It has lots of sections that we went through today. It will take some time for us to look at that, review that. And I think the questions that I'm hearing today, just about the importance of the dialogue once they are submitted, right? And so it's not submission, no dialogue with Ontario Health and the Ministry of Health. I want to be very clear on that. I know Zara and team at Ontario Health have set up a pretty good structure to make sure that ongoing dialogue once submission happens, to really understand, not just by reading an application, right? By really understanding what will this translate to and what will happen on the ground.
Thank you. Is there Indigenous evaluation criteria included in the assessment? How will equity criteria be developed and assessed in the selection of successful applications?
Thank you for the question. One of the things that I think not one of the things, but looking at the evaluation of what comes in through the EOI will be very aligned with the questions that we've asked in the EOI form. So I hope, as Fernando went through the EOI, you were able to see where we will be, where we will be looking at in terms of evaluation. So increasing access to care for unattached patients, I think, with poor health outcomes and health status, will be part of our evaluation. We do have some data. Many of you are probably aware of the Public Health Ontario's Marginalization Index, which looks at different components of marginalization, whether it be ethnicity, whether it be employment income, whether it be other things that I think are in that PHO marginalization index. So all of those things will be considered in the evaluation framework to ensure that we're not just saying equity, but we're looking at it in a way. And I would strongly encourage you to please include information and data that you have in your local communities with respect to equity deserving populations. We don't have all of the data. We have some of the data. We have some proxies in our data. You know, we are trying our best, but please include that if you have that information from your local communities.
Thanks. Is there a maximum number of administrative support per FTE complement that we're permitted to put in, and to add in resources for leadership, HR, IT, etc.?
No. There are no restrictions on the number of HR resources we can request. You can request. I think really thinking about the expression of interest in its entirety is important, right? So really think about what you're trying to do in your local community and what you need to do it from a direct service delivery standpoint, as well as from an administrative infrastructure standpoint as well. So there are no restrictions at this time, because we really want to understand what's needed in a local community and what HR is required. Then there might be a bit of a back and forth discussion and dialogue. We do that here at the ministry and at Ontario Health, and having a dialogue so that we can better understand the FTEs that are requested. But I wouldn't go in with saying there is a restriction. There is no restriction.
I think you've addressed this one already, but we may want to emphasize this one. There's been some conflicting messages around who can submit an expression of interest. Are all organizations welcome to submit?
Thank you for the question. I'm concerned that there is conflicted messaging, and I'm glad I have the opportunity again to say this is an open call for applications. Everybody has the opportunity to submit the expression of interest.
Is there a common measurement framework for IPC teams that we should refer to for question 3.2? I don't know, Fernando, if you want to take that very specific one.
is 3.2, the FTEs program description. I think that's the one. Proposed program and services. Okay, so you have a program name, you have the FTEs, you have a description, you have a goal, and you have a target population and a target number of patients. I think that's 3.2. There isn't a common performance, like there's no numbers that we're looking for in particular in this particular section, but we encourage you to fill it out based on what you think is needed in your local community. Fernando, anything to add?
No, I think that covers it. I think the other thing, well, okay, I'll add something. I think some of the associations that are in existence have done some work around what are appropriate measures and so on for the different types of programs. So you might want to tap into some of those linkages to see, how do you measure outcomes? There's many ways of measuring the same program, but there are some more common measures utilized for those for certain types of programs like diabetes and mental health and stuff like that you may want to tap into. There's lots of information out there about that, but we don't prescribe a measure for utilization within the teams necessarily.
Another very practical question, is there a word count restriction to open-ended questions, and is there a maximum page limit for submissions?
No. Please answer the questions in the EOY as Fernando described it. So there's no word count or restrictions, but tell us what's the most important. We're expecting a lot of applications, but I really don't want to limit what you want to tell us here at the Ministry and Ontario Health.
Given the short timelines for submissions, what are the expectations from the Ministry and OH in terms of consultations that have been done?
I think the expectation from the Ministry and Ontario Health is we do expect in this time frame to have a consultation with partners. That is articulated in the expression of interest. It is a short timeline for sure. So I think what we're saying is do the best you can. Include for us, consultations that you've completed. If you feel like it's a really short timeline, which it is, please include for planned consultations that you have, right? So after your submission, if you have planned consultations that you'd like to include in your submission, please include that. And, as I said before, the dialogue continues after submission, and I just want to be open and clear about it. It won't be the next day. So just to manage expectations about getting a full response to your EOI, a couple days after. But I think, as we review and co-manage this with Ontario Health, we will absolutely be having a dialogue within our organizations, but also with proponents. I don't think everything will be articulated on a piece of paper and we won't have any questions. That won't happen, I don't think. Maybe it will in some instances, but we want to encourage that dialogue, and we will have it.
Thank you. We hear about the need to address marginalized vulnerable populations. Will equity-seeking groups such as Francophones, Black, and Indigenous groups be prioritized?
Yes. It's part of the evaluation criteria. It was part of the budget announcement. It's included in the EOI and the language. So really looking at equity deserving populations will be prioritized. Yes.
As an existing team, do we need to define our current HR complement and what they're doing versus the expansion request?
I think if you're an existing team, we know your HR complement. We are asking for you to include in your EOY what you're asking for in terms of net new. We're not asking you to tell us your budget. We have your budget. We know what it is. We're working very closely with Ontario Health. Some of the questions that I have been getting is, we know that the funding relationship and connections are across both organizations, but we are working together. So if we're looking at a CHC application, that where the funding comes directly from Ontario Health versus a family health team application, which receives direct funding from the Ministry of Health. We both have each other's budgets, and we're going to talk about it. So we don't expect you to tell us your budget. We know your budget and the HR, but please submit your net new ask.
Can we apply for more nursing even if it's over the 50%? Can NPs be removed from the nurse count?
I will have to take it back on the NPs being removed from the count. That's the first time that I've heard that, but I will take that back. I know the guideline on 50% nursing was put into place as we looked at comprehensive primary care. That is a guideline that we will look at, but I wouldn't limit that in your application. That is something we will look at and engage in a dialogue with you on. If you wanted to ask for more nursing over the 50%, you can do that in your application. And I would encourage you, as you're completing your application, to have that dialogue with us in Ontario Health.
So you've touched on consultation a little bit, and as expansion to that, what about the expectation for community and patients to be consulted?
Yes, do the best you can. I know there are a number of organizations that have existing organizations that have patient and family advisory councils. I know that's tough to do when you're thinking about a net new team, but I would say do the best you can in that area of consultation, which is really important. There's also a lot of, I would say, recent patient experience surveys that have been done. Many of you may be aware of Our Care. You know, that has a little bit of information on there. I know that's not a direct consultation, but where you can build in patient consultations within the time that you have, please do so.
Maybe we'll do one last question, so coming up at time. We talked about unattached, addressing the needs of unattached patients being important. Are uninsured populations also included in that?
Yes.
Okay. All right. So thank you everyone for submitting your questions today. There's a lot of questions that came in. We addressed the ones that were the most popular and the ones that we could sort of within this time frame. But we will take all those questions back and take a look at them. So thank you for that. So on behalf of Nadia and Fernando and myself, just want to say thank you for taking the time to attend the webinar today. We really are looking forward to all of your applications, the Ministry and the OH. We will be reading all of them very carefully and sort of appreciate you sort of taking the time to represent the needs of primary care as we sort of move forward and ensuring the fact that Ontarians have access to good quality primary care. So thank you everyone and have a good rest of your evening.
Thank you,
Bye.
everyone.